Welcome to Health Accelerated, brought to you by OSF HealthCare. I'm your host, Shelli Dankoff. This is part 2 of our look at the 10-year anniversary of the Jump Simulation and Education Center in Peoria, Illinois, part of OSF HealthCare. In 2013, the Jump Simulation and Education Center, or JUMP, was introduced as a space to dramatically improve outcomes and lower costs in healthcare. Since then, the building has become the hub of OSF Innovation, where cross-functional teams converge and leverage their expertise to advance the future of healthcare. In our last episode, we discussed the amazing journey of JUMP and OSF Innovation and the achievements of the past 10 years. Today, we take a look ahead to the next decade and beyond. Joining me, Dr. John Vozenilek, Vice President and Chief Medical Officer for OSF Innovation and Founding Executive Director of JUMP, and Becky Buchen, our Senior Vice President of Innovation for OSF HealthCare. Thank you both so much for being with me today. We talk a lot about that testing and getting to that point. One of those things, rigor. I hear you talk about that often, how innovation, PI, rigor, all those tie together. From your perspective, how do those all tie together and how do you define them?
Really, you have to understand and build upon the problems that have been identified, where something is going to be deployed and tested, what we're going to be measuring in terms of what success looks like, how we're going to sustain it, how it's going to be implemented within the workflows of our clinicians. That's extremely important. Because if it's not integrated within their workflows, both within the electronic medical record as well as their process flows as a clinician, they're not going to try something new and you're not going to get that transformation. So really outlining ahead of time what you are going to be testing is really important. And that's really how we're applying that part of the rigor from a testing perspective.
Dr. Vozenilek, your perspective?
There's a lot of structure to support the idea of moving forward with good learning. And frankly, innovation is a service. It's a service to our patients. It's a service to our mission partners here at OSF, and a service to the partners that exist outside of OSF. And even as you contemplate what it would be like to try to find the adequate partners to make ideas come to life, it takes a lot of nurturing, shaping, infrastructure to make sure that these things land well. For example, in order to attract the attention of our academic partners, the University of Illinois, College of Medicine here in Peoria, the University of Illinois in Urbana-Champaign, the Bradley University, UIC, and now ISU, we had to form up key ideas that OSF was interested in and present those to our partners. And then we had to create laboratories and structures so that the investigators from each of those areas and their diverse disciplines can come and meet with us on a level playing field, understand our priorities in service to patients, understand the technology barriers that we perceive, and how they can partner for us.
OSF HealthCare serves a lot of rural communities. And let's be honest, healthcare is changing. You can't have a complete neuro team or a complete cardiac team in every facility. So let's talk a little bit about some of those rural health initiatives, because there's also people in those communities that they're used to their local doctor. Coming into the bigger city is a little scary for them, but yet they deserve and want that care at home. What are some of the inroads we've been making in those areas over the past 10 years and ahead? I mean, as we look ahead, what types of things we'll be looking at?
Let's first consider the Central Illinois grit, right? This is a do-it-yourself type of a community. Here is also the foundation of innovation, where people find a way to move past struggles and obstructions. Now, no less in our clinics, hospitals, and other environments out in our ministry, some are very small critical access hospitals. So they have the innovative spirit. They want to do the outreach, and they also have this can-do approach. And actually find this to be a great substrate or foundation for networking with them to provide new solutions. Now, what are those solutions? So what we look at in our future, and I think everyone today has experienced the immediacy of data. Data is at our fingertips in our phones. We're surrounded by data. Our data is being used by commercial enterprises to sell us things and to promote things that they want to promote. No less important is the health and wellness of our communities. So OSF has invested heavily in understanding how we can leverage data and data science to shape the information, to combat misinformation that exists out in the community, and to really develop a trusted relationship with rural populations for their health and wellness. A key importance is preventative measures that will find patients who are at risk for diseases that can be devastating, like cancer or other chronic illness, to partner with them in a trusted environment where their data is safe with us, the trusted partner, and they can rely on us to provide good service.
So as you sit here and look at the hospital of the future, how are you seeing it based on what we're seeing take place in this building and throughout OSF Innovation and then into OSF Digital Health?
When COVID hit, really it allowed us the opportunity then to bring together all of those things that had been tested into one model. And really thus launching the digital hospital. That has expanded into, again, hospital at home. A lot of various programs that are being offered from a tele perspective.
The technology is very portable, and it takes up less and less bandwidth, in our systems for information sharing. There are even little buttons that one could wear on the skin that actually can give vital sign data. Miles and miles away can be interpreted by clinicians. We are in the long game to promote, the building of, new trainees, medical students that become residents, become specialists along the path. There's a current and pressing need. And so we build technology solutions that can back up those specialists so they can give proper consultation, even if the distance is quite great.
I want you to look in your crystal ball. I'm going to put a big crystal ball right in front of you. What does the next decade hold or beyond?
Certainly thinking about how we're going to integrate artificial intelligence, machine learning. So thinking about the data and the power of the data to really serve our patients in a different way. And it truly is about being proactive for them, easing their way before they even know that they're going to be engaging with a healthcare system that's complicated, certainly to navigate. So seeing that, thinking about, yes, certainly we've started the journey for digital transformation, but really where is that going to take us? Because as you look at other industries that maybe are a bit ahead of healthcare in terms of their digital transformation journeys, we have a ways to go, and that is going to be about connecting the data, understanding our patients better, being proactive in terms of the data, and being proactive so that we can ease their way throughout their journey.
We're aware that here in Illinois, there are more than 5,000 communities that are real small. There isn't much going on in terms of healthcare in the communities, and frankly, the communities are getting a bit older, and people are moving away from those communities. What we're looking at in our future is how we can create scale with those communities to provide service within those communities by partnering with them. Perhaps by training members of those communities as trusted parties that come together with us in our healthcare journey for prevention and to follow up for treatment and for survivorship in the case of cancer. We want to partner with those communities. We want to bring service to them through digital means. We're working on a whole platform for rural digital health innovation that I think will transform and become something scalable perhaps across the United States in the next 10 years.
I don't think we could say it any better. So with that, Dr. John Vozenilek, Becky Buchen, thank you so much. A wonderful discussion and a great look ahead to the future of OSF Innovation and the Jump Simulation and Education Center.
Thanks,
Thank you.
Shelli.